It's a pleasure to welcome you to another edition of NAFDAC and Your Health, where you get to know about the activities of NAFDAC as they ensure that only wholesome food products, quality drugs, and approved medical equipment are made available for public use. I am your host, Amanda Ugo.
On today's episode of NAFDAC and Your Health, we will be focusing on the ways through which NAFDAC collaborates with other agencies, both locally and internationally, and how the support NAFDAC gets from international organizations helps the agency in delivering optimally in safeguarding the health of Nigerians. Of particular focus in this regard will be the support of the Bill and Melinda Gates Foundation to NAFDAC and the diverse ways the foundation support has been of advantage to NAFDAC. The mandate of NAFDAC to safeguard the health of the Nigerian people places a huge task on the agency, considering the heterogeneous nature of the country, the number of products under the agency's regulatory purview, the peculiarities of the various manufacturing industries that produce these products, the avenues through which these products get into the market, their distribution chains, market forces, the economy, and so on. These, among other factors, are all NAFDAC has to deal with and must be in total control of for the agency's regulatory mettle to be proven. This is why NAFDAC has to employ the strategies of collaboration and partnership with other agencies and organizations whose work and focus are in the different areas that relate with the various aspects of NAFDAC's regulatory duties. This has seen NAFDAC working closely with the Pharmacists Council of Nigeria, the Standards Organization of Nigeria, Nigerian Export Promotions Council, and the Manufacturers Association of Nigeria, and so on.
Government is not God, but government has wisdom in creating agencies. Let me just give an example of PCN, Pharmacy Council of Nigeria, and NAFDAC. Pharmacy Council of Nigeria's focus is on making sure that the professional practice is well done. Both the practitioners and the sites from where they practice. NAFDAC has a mandate to ensure that what is inside that practice site is of quality. So if PCN and NAFDAC do not collaborate, everybody working in silo, who is going to suffer? The public. So our collaboration has led to the closure of the open market in Kano. You give room to the other agency, listen to their perspective. The other agency gives room to another agency, the other agency, everybody brings their perspectives to the table. Team spirit. I cannot know it all. So I have to train myself to listen if somebody else is talking. The other person must realize they cannot know it all too. Is to listen when I'm talking or when we are talking or whatever. So collaboration is extremely important for exportation, for example. NAFDAC's mandate is to regulate, control, importation, exportation, manufacturing, distribution, advertisement, and so on. Importation, exportation, we have to collaborate with customs. It is such collaboration that led us to intercept 24 containers of tramadol in 2018-2019. It is such collaboration that will lead custom to call us when they seize a product, because they get in touch with our regulated products too. And if they suspect disease and they call us, we don't, this is our mandate, your mandate goes beyond what we can do. Can you come? That's collaboration. That is why when government makes an act, it is not a totality on its own. It is to work with others so that the outcomes will be good, so that our economy will grow. If not, silo mentality will kill the economy.
Apart from collaborating and partnering with other agencies locally, NAFDAC also works in partnership with international agencies, organizations, and foundations. The agency also gets support from these international organizations to help her in the responsibility of safeguarding the health of Nigerians. One of such organizations is the Bill and Melinda Gates Foundation. The Bill and Melinda Gates Foundation is an American private foundation based in Seattle, Washington, D.C., in the United States of America. The foundation, launched in the year 2000, is reported to be the third largest charitable foundation. The primary stated goals of the foundation are to enhance healthcare and reduce extreme poverty across the world, and to expand educational opportunities and access to information technology. As the goals of the Bill and Melinda Gates Foundation align, the foundation has collaborated with NAFDAC on a number of projects. These projects include the funding of the Central Drug Laboratory to strengthen its ISO 17025 accreditation and WHO pre-qualification. The Bill and Melinda Gates Foundation also collaborated with NAFDAC to improve the agency's reliance review process.
NAFDAC and Your Health continues shortly.
NAFDAC wishes to sensitize the general public on the detrimental effect of alcohol consumption by underage. Underage drinking can result in psychosocial and health problems like poor academic performance, increasing crime rate, alcohol dependency, mental health disorder, cardiovascular problems, kidney and liver diseases, and even death. NAFDAC advises parents and guardians to stop the exposure of young people below 18 to alcohol by asking them to sell or purchase it. Manufacturers must desist from packaging alcohol in sachets and small packs less than 200 ml that are sold in attractive and affordable prices for the underaged. Together, we will fight the scourge of underage alcohol abuse. For more enlightenment on NAFDAC activities, watch NAFDAC and Your Health program every Monday, 6:30 p.m. to 7 p.m. on TVC, and every Tuesday, 8 p.m. to 8:30 p.m. on NTA. NAFDAC, safeguarding the health of the nation.
Welcome back. You are still watching NAFDAC and Your Health.
Concerned about the menace of substandard and falsified SF products in low and middle income countries, including Nigeria, the Bill and Melinda Gates Foundation sponsored 3 main activities to fight against the menace. These activities included the review of the National Action Plan against Substandard and Falsified Products, risk-based post-marketing survey of selected products to guide regulatory actions. Advocacy and grassroots community sensitization are considered powerful tools in the fight against substandard and falsified products. Counterfeiters often exploit the ignorance of consumers who purchase these items. When people are educated about what to look for, they are more likely to avoid SF products. The strategies deployed for the advocacy and grassroots community sensitization included utilizing print materials for advocacy to community leaders and grassroots awareness sensitization of stakeholders on substandard and falsified medicines. Print materials like flex banners, posters, and stickers are used to effectively share important information and promote community awareness about counterfeit medical products. These materials were displayed in public places such as schools, traditional rulers' palaces, public offices, and others to remind citizens about substandard and falsified products. Social media platforms like Facebook, Twitter, and Instagram used to share jingles, posters, stickers, and roll-up banners were also used to create awareness and advance the campaign. At the Federal Capital Territory, FCT, during the opening remark at the flag-off of the campaign, the critical need to address the growing issues of substandard and falsified medical products in Nigeria, which continues to pose serious health risks to patients and undermine the integrity of the healthcare systems, was raised. Other states where the sensitization campaign also held on the basis of geopolitical zones include Adamawa, Northeast Zone, Kaduna, Northwest Zone, Plateau, North Central Zone, Oyo, Southwest Zone, Enugu, Southeast Zone, and Rivers, South-South Zone. The South-South Zonal Director, Mr. Chukwuma Olegbo, also spoke about NAFDAC's efforts to curb the circulation of substandard, falsified, and unregistered products.
Earlier on, we have some companies that do not exist who want to make submissions for registration of their product. But for any product to be registered now, we ensure that the facilities are inspected and they are compliant with WHO pre-qualification before they are registered. We have inspectors from Nigeria who visit the facility. That's for the foreign inspection. Locally, we do inspections of the local manufacturers too, as a way of stepping down all facility manufacturers, local manufacturers, and ensure compliance.
During the sensitization workshop in Oyo State, which was themed The Roles of Effective Risk Communication in Consumer Exposure to Falsified and Falsified Medicine in Nigeria, the Southwest Zonal Coordinator, Mrs. Roslyn Ajayi, speaking on behalf of the NAFDAC Director General at the workshop, said the sensitization became imperative to encourage healthcare providers and relevant stakeholders to admonish users of fake and substandard products, particularly drugs. The Southwest Zonal Coordinator went on to enumerate the strategies employed in curbing fake and substandard regulated products. These include product registration, which is mandatory for any product before it can be certified okay for public use. She also mentioned documentation, facility inspection, and laboratory evaluation as part of the processes. She also said NAFDAC is aware that most manufacturers deviate from the standard and criteria under which they get registered, and this is why the agency carries out post-marketing surveillance to randomly sample products to confirm their wholesomeness and to ensure that they are not falsified. Speaking further through the Southwest Zonal Coordinator, the NAFDAC Director General said one of the strategies NAFDAC has been using and will intensify is aggressive sensitization and engagement of different stakeholders, particularly those who are into the distribution of healthcare products like medicine.
The incidences of substandard and falsified products is a global issue. It is the responsibility of every country to adopt strategies that is workable within their own system on how to curb these incidences. And that is why in Nigeria, post-market surveillance is being strengthened. The activity of post-market surveillance in Nigeria that is handled by NAFDAC is being strengthened from time to time. And the players in the industry, we cannot always do this alone. That is, yes, NAFDAC has the mandate, but we cannot fulfill that mandate without the collaboration of the players in the industry. And that is why from time to time the issue of sensitization, creating awareness and interaction with the key stakeholders is important. And today, the sector that is being focused is the distributors. That is why you have been brought into this forum to interact with you, to share our concerns with you, and to, through clarification in case there are gray areas that are issues of concern, both for NAFDAC and for your sector. That is why we are here this morning, to make a presentation of the journey so far, the findings that we have had, and then the way forward in handling and tackling issues of substandard and falsified regulated product, particularly medicinal products.
In conclusion, the NAFDAC DG said the efforts will yield more positive results as the agency continues to pursue the eradication of falsified medicinal products in Nigeria. Similarly, the sensitization took place in Karu, Nasarawa State in the North Central Zone.
What we want to achieve is that we have a healthy nation. Because if you don't have a good health care, you are in big trouble. And even if you have very sound personnel for health, and then at the end of the day, drugs are not good, then you are doing nothing. Best of doctors, best of nurses, pharmacists, and lab scientists, medical lab scientists. But as far as at the end, they will need drugs. And then the drugs that are given to them are not of good quality. You don't know what. So our own is to make sure that we ensure that products that get to patients from where they are manufactured to where they are used are of good quality, effective, and safe.
Our society needs to be safe. Our society needs to be carried along in whatever we do. We in business, both in drugs and food production, we need to take care, and that is what NAFDAC are doing here. NAFDAC are doing a very excellent job, and to the point that this sensitization program today is improving a lot of us.
The Bill and Melinda Gates Foundation supported sensitization, provided participants the avenue to rub minds and seek clarifications from NAFDAC when necessary. They also promised to work together with NAFDAC to ensure the safety and well-being of the nation. The Port Harcourt South Zone of the sensitization campaign was also well attended by stakeholders and the press who, apart from getting enlightened and informed, can also cascade and disseminate the information and safeguard measures to the public. One of the key points raised here was the need to put in place stiffer penalties for offenders, as current legislation allows for an option of 1 million naira fine or imprisonment.
Most of these things happen because of our laws. There is no stringent penalty for offenders of counterfeit or fake products. Now, how can you factor a scenario where a counterfeiter brings in a container of unregistered or a counterfeit medicine and is apprehended, he's arrested, charged to court, and for those maybe running into millions of naira of that container, the penalty at the end of the day in court might be just a chicken fee.
In these states where the sensitization campaign took place, officials visited traditional rulers to seek their support and influence. They urged the rulers to inform their communities about how to access quality, safe, and effective products for their people. Also, among the stakeholders that visited the sensitization campaigns were health journalists, national associations of patent and proprietary medicine dealers, NAPMED, associations of community pharmacists of Nigeria, ACPN, the Nigeria Police Force, Nigeria Customs Service, hospital and administrative pharmacists, State Ministry of Health, and so on.
That's our package on this edition of NAFDAC and Your Health. You can also be part of NAFDAC's efforts to curb the activities of peddlers of unwholesome food products, fake drugs, cosmetics, and medical equipment by supplying NAFDAC with any information on these criminals.
You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded.
Do not be part of criminal activities like producing, importing, marketing, distributing, advertising, or selling of unwholesome food products, fake drugs and cosmetics, and unapproved chemical and medical equipment. These acts pose great danger to the health of Nigerians. Till we come your way again next week, where we shall bring another insightful package, please stay safe.